today, obviously, we're going through some stressful times, and we're constantly looking for additional solutions to help support our practices in an environment that just keeps changing day to day. We've seen some changes recently, like telehealth. We've implemented that for several practices and continue to onboard many more. And then with the government and the regulations, with the telehealth, they've gone from lax at the beginning to more lax, and now there's actually discussions from CMS about incentive pay for people that are going to implement that into their practices. So again, ever changing things that were probably coming out in the future or the near future, and this just forced our hands a little bit as a community and a business to put this stuff together a little bit earlier. We're seeing a lot of people look into cloud and hosting so they can work remotely. A lot of practices are staying open, but avoiding the actual office, avoiding going in, practicing the social distancing rules to deal with this COVID-19. And working from home for us, it's obviously a change as well. Our office has been at home since March 13th now, and things along the way seem just as normal as ever. But then when you do something for the first time, it seems a little different when you're doing it from a different environment. For example, this is the first webinar that I've hosted from my house, and I've probably done 1,000 from my office, and it felt a little different setting up. Like, do I have everything I need? With the practice support that we're offering today with this webinar, we're trying to help patients, but also help our practices. It's a way that you guys can maintain or even grow your revenue stream during a time where patients are avoiding coming into the office out of fears of their own. And some of your older patients and sicker patients might actually need that direct care, and they're unable to get it today. So we're constantly looking for other solutions that can help all of our practices and help patient care. If anybody comes across any suggestions, perhaps give me a call, email me directly. Again, my name's Adam Lombardi. At the end of the webinar, I'll provide my direct contact info. We're always looking for the tools that we can deliver to try and make life a little bit better for everybody out there. And then some other things just to make note of is if you do have some downtime today with lower patient flow, anything like that, it might be a good time to take advantage of that downtime to learn or implement something new that you didn't have time to do while you were so busy. Some things might be, dictation, speech recognition, a billing software, population health, or maybe some additional training that you didn't have the time to put aside because you were busy seeing so many patients. So with this practice support solution that we're offering, we've partnered about 5 years ago with these guys. I have David Hunt on the webinar and also Michael Knipper. They are true chronic care management experts that we've been partnered with for about 5 years now, and they have made a splash in the industry as far as providing better care, learning, and being ahead of times with the industry changes. And we decided that this could be a perfect fit for what's going on today with all of the stresses that all of our clients are experiencing and all of their patients are experiencing, and turning some of that over to the experts that can get us all through these times. So with that, I'm going to pass it along to David, and we are going to keep everybody muted during the webinar. There will be a session at the end for questions and answers, and there is a section where you can type in a question. If you type in a question at any point, we will read those at the end of the webinar and answer those to the group.
Great. Thank you, Adam. Good afternoon or good morning, depending on what part of the country you're in. I appreciate everybody taking the time today. Much thanks to the team, Adam and the rest of the team at Amazing Charts, for allowing us this opportunity to speak and highlight what we're doing for many of the practices that we're already working with Amazing Charts. As Adam had mentioned, we've been working with Amazing Charts back since 2015 on the chronic care management front. Back then, there weren't a lot of hands going up when I would speak to the providers on CCM, and that has significantly changed in the last 5 years. Very much so in the last 2. And then as we got into 2020, pre-COVID, we were really just seeing far more interest. So looking forward to the discussion today. Prior to talking, I really wanted to just my applause and true appreciation for all the healthcare workers that are that are on the line today. Many of those clients that we have throughout the country, just doing an amazing job, very difficult situation. I talk to providers every day, and my hat's off to everybody that's just doing an amazing job to help, primarily just the population in general, and then, your individual patients as well. So looking forward to appreciate everybody's work there. So one of the things I wanted to talk about is today's environment. And so, we have hundreds of practices that we're working with across the country. And physician practices in general today are either closed, they've limited their hours, they're finding, the revenue has been significantly impacted by, COVID and the lack of visits into the office. They're doing telehealth visits, but they're really scrambling to plug in the appropriate, technology. They're, depending on their patient mix, some of their patients just aren't capable of that telehealth environment. And so they're trying to get their patient population up to speed on that. And they're trying to deal with a lot of what's going on in their staff. They have individuals that have family obligations. Schools are closed down, child care options that are there, their health. I have a few practices where they've had COVID positive tests come back, and that sends a concern throughout the practice. So as they go remote to address those issues, and this is all impacting labor costs and decisions for how the practice is moving forward. On the patient side, and primarily the older adults, which many of our practices have a large group of, they're isolated. They're scared. They're off their routine. I know, my own parents and many of my colleagues, their parents and older adults in general. There's the neighborhood walks, there's the parks, there's the adult daycares, there's the church. There of just a variety of routine that it's now been disrupted. For many of us, we're busy at work supporting, even though we're remote, we're busy supporting, long hours trying to fill the gap for what this crisis has created. But for many of those older adults, it's a very, very challenging time. And so in addition to just the concerns around COVID-19, they have the symptoms and the comorbidities that existed prior to that as well. And so, we don't want to be able to lose that and what's going on in that environment. And we're just finding that there's an opportunity now because of COVID to touch them more and because of these programs. So we're seeing a lot of the anxiety driving enhanced through some of the mental health risk. We're seeing a lot of changes in functional and cognitive impact to this patient population. As I mentioned, they're not getting out for the walks. They're isolated. They're not eating as well. Their anxiety levels are up. So there's a lot of changes in the functional and cognitive health, and they want welcome and look forward to engagement. And many of them are looking towards their physician practices. In addition to that, you have the healthcare continuum, the assisted living facilities, the independent living facilities, a lot of which I'm sure some of your patients are in. You have home-based providers that are trying to deliver care into the home. You have shortages around the monitoring devices, testing, and so forth. The skilled nursing facilities are challenged. We work in a lot of environment there, and I'm sure as many of you do. And the Part B providers. So the healthcare continuum as a whole, not just the physician practice, is impacted. So this is what we're hearing every single day from our physician practices. Now, prior to COVID, we were really looking at, and we were growing rapidly around, managing chronic conditions in the gaps of care. And so as we have built our solution to support that, we are working in a remote environment in many cases, in some cases, combination of remote and with inside the practice. And we were focused around that high risk patient population with 2 or more chronic conditions, leveraging the programs that were available. That included chronic care management program, the behavioral health integration program, and the remote patient monitoring program. And we were looking across our data, and we've had, as the multiple conditions went up, the cost of care went up. The cost to the practice to support those individual patients was significantly more. And so as we looked across hospital readmissions, we looked across Medicare in general, we just realized that this was a major strain on the practices, and there was a need to leverage these programs to help support the care coordination of the high risk, high utilizers of care. There are three programs that we'll be talking about today. The first has been around since 2015. That was leveraging CPT code 99490. It's the Chronic Care Management Program. Early on, there was a lot of interest out of the gate, and it waned a little bit, truthfully. People were wondering, how does this work? Do we leverage our internal systems? Do we leverage a partner like Cosan? Do we leverage our staff, a combination of other staff? How do we do this? And then in 2017 and 2018, we started to see some more engagement. It started to pick up again. In 2019, we were every single week adding new practices. And then in January of 2020, it significantly changed when they added the G2058, which was the additional incremental blocks of 20 minutes. Prior to that, it was 20 minutes, or it would be complex care, 60 minutes or more. And so what we're doing is looking at how do we engage that time in a valuable way to support the practices, but also to support these patients. And I'll talk a little bit further about that in a minute. Then we have CPT code 99484, which is the behavioral health code. That started in 2018. In 2019, we added into our suite of tools 99454 and 99457 with the remote patient monitoring. The combination of those three programs, and Adam had mentioned earlier, many of the changes over the last month to the way that these programs can be leveraged, we end up with anywhere from 20 minutes to 2.5 hours of remote patient engagement on a monthly basis. And at the end of this, I provided a code suite that everybody could look at to look at some of the codes that are available in addition to these as well. But that is 20 minutes or 2.5 hours up to utilizing for different cohorts of your patient population these codes to A, engage that patient a lot more, and B, to drive practice revenue. So let me talk a little bit about these programs in more detail. Remote patient monitoring is our ability in collaboration with the practice and at the direction of the practice to work with patients to collect remote vitals on a daily, weekly, and monthly basis. We have the first 20 minutes that are available to us, and we have additional 20-minute blocks, very similar to the way that CCM is run. We currently work with two different ways to do it. We have an app that we can send out, and we also have a tablet. Both allow us to Bluetooth connect devices to those so that if we send out a blood pressure cuff, a weight scale, a pulse oximeter, a thermometer, each of those would end up, once the patient either stands on that, puts the blood pressure cuff on, or utilizes the pulse ox, that data is fed to the tablet and fed back to the practice. We have teams that are monitoring that. If you were to look at across the patient population of 500 patients, we would look somewhere in the neighborhood of 20% of that population would have that particular remote patient monitoring usage. CCM, we're typically engaging on a monthly basis, 87% of a population that would have 2 or more chronic conditions and would be eligible for that program. We're offering right now, prior to January, we're leveraging that 20-minute block. We were not utilizing the 60-minute complex care as much, but we were finding ourselves with 30 and 40 minutes quite frequently with the higher risk, high utilizers of care. And then as COVID has started, we're now actually moving into the 40 and 60-minute blocks quite frequently, having weekly calls with the patient population and engaging them in just meaningful ways. And then that dialogue is transferred over to the provider. And based on clinical programs that we're doing with them and that they have in place, we're helping patients manage medications, get connectivity to telehealth visits, building comprehensive care plans, making sure they understand what those are, connecting any gaps in care, and then looking at different quality measures that the practice needs as well. We also have the behavioral health integration code, which is centered around mental and behavioral health. And we're typically using for about 30% of the population at any given time, and especially now with COVID, we're actually looking around a 20-minute block for that, helping us deal with those patients that have the anxiety side of things or mental health issues that are being exacerbated by COVID-19. The way our teams work today is we see ourselves as an extension of the practices. The practices are driving the clinical protocols. The providers within those practices are asking us how we should leverage our information in Amazing Charts. We are remoting into Amazing Charts with our teams, and we're putting information in there that will be beneficial for the providers in real time. And we send them alerts on information that needs to be addressed immediately, and we're updating the patient charts on information that needs to be addressed at some point. So we're looking at the different clinical protocols and pathways that exist. We're mimicking that in a remote environment, which is very much has a direct correlation to what we're doing today. And we're applying a combination of our team or the staff on site or staff remote to help in that staff augmentation side. And so we're finding tremendous success in being able to plug into a staff that maybe has a group of their employees that need to have family obligations and aren't as available, if they have health concerns with part of their staff, or if just due to the fact that the revenue is down by 50%, they need to augment that staff. We can layer in our staff, drive additional practice revenue, and reduce their overall labor cost while keeping all their information in Amazing Charts up to date. Some of those things that we're doing. Remotely, we're reviewing the medical records. We're looking at some of the different information within the system from a quality measure standpoint. We are running COVID-19 screens. We are working with the patients around their different conditions and clinical pathways, setting up telehealth visits, making sure that patient is engaged in a telehealth environment before scheduling it with the provider. We don't want providers, as I'm sure all of you, don't want to be spending 10 minutes of a call trying to get somebody connected. So we do a lot of test runs with people prior to a telehealth call. As they come out of the telehealth call, similar to walking in, walking out, there'll be 5 or 6 or 7 or multiple pieces of information that need to be followed up on, and we're doing that as well. So in a virtual environment, the providers coming off a telehealth call are communicating with our team. We're updating, we're following up with pharmacies, we're following up with the patients, we're following up with the POAs, and we're collaborating with the staff. In addition, we also have our text messaging and bot. Both of these are working tremendously valuable when you have larger patient populations that need to be connected in very short intervals of time. And so we send the bot out using a COVID-19 screening because we know that these patients might feel good today, but by Sunday or Monday, they could feel completely different. So we're asking questions like, have you been exposed to anybody? We're asking questions, do you have a fever? Do you have headaches? Do you have body aches? We're asking those questions. We're getting real-time information. And based on the answers, we're triaging that with phone calls back to the patients and then communication into the provider. We're also doing that across some of the other conditions as well, because we recognize that COVID-19 is a main focus, but this is the new normal, or some version of this is the new normal coming post-COVID-19. And I'll talk about that in a minute. Some of the additional modules that we're running is around risk stratification. I won't go into each of the details here, but we're also looking at this as an opportunity to run risk stratification across a patient population to support some of the population health initiatives that you have. And so we're looking at things like falls risk, using Johns Hopkins falls risk assessment, the STEADY assessment, using a CAGNY mortality index. So we can serve up to the providers kind of an overall snapshot of what your patient population looks like. And through this dialogue and the engagement, both through our teams physically calling these patients, as well as through the bot and through the text messaging. Our ability to kind of flex those based on the amount of patients we need to reach in a short period of time, we're doing that very quickly. These are some of the BHI modules that we're running. And so the combination of CCM, BHI, and RPM is allowing us to drive a tremendous amount of data back to the provider in the gaps of care, so that between telehealth visits, or hopefully very soon between office visits, we're able to provide, prior to walking into that exam room or getting onto that telehealth visit, a really nice snapshot of what's going on in that patient's life in real time. This is just an additional dashboard that I'd like to show as how we triage people in this environment. This is looking at some of the falls risk. We're seeing a tremendous change in falls risk right now as people are isolated. We're serving that information back up to our providers in real time, and we're triaging it, leveraging our medical assistants, and nurses in collaboration with the staff nurses and medical assistants where they're available, and most clearly with the providers. One of the items where the chronic care management program that we've had over the last 5 years has really come into play is we were already managing care in the gaps, and we're already doing so remotely. So this environment that COVID has put upon us is not different to us. It's something that we were actually very used to. The majority of our medical assistants, with the exception of a few that do work on site, are remote. We securely remote into a practice's EHR. We are working with the patients. They're used to speaking with us remotely. They're used to using telehealth in many cases with us. They're used to having a weekly or a biweekly or a monthly call with our teams. So we're identifying risks, we're capturing touch points, we're aligning with their wishes, and we're moving in a direction to provide better engagement, enhanced outcomes, and reduce hospitalizations prior to COVID-19. And now when you overlay this conversation during COVID-19, we're just expanding that environment. So we're doing COVID screening, we're doing identifying risk, we're monitoring existing conditions so we don't lose sight of that. We're augmenting a physician staff. We're scheduling weekly telehealth visits based on risk, based on feedback on different screens, and based on the needs of the practice. We're managing the schedule, both post and pre-telehealth visit or office visits, and we're providing support through increased patient engagement, driving additional practice revenue, triaging high-risk patients, and operationalizing that to help a physician in a remote environment. So the correlation pre and now during COVID is very, very similar for us. So it's very much a plug and play, something we can do very, very quickly. And in that high touch environment, we're just getting phenomenal feedback from our patients. Our patients, they're your patients, love hearing from on a daily basis. They're coming back to the providers and they're telling them about the experience of being, how comforting it is to have a call on a weekly basis or a bi-weekly basis. And it's really helping tremendously, and it's helping the providers. So we put together, many of you might have seen this video that we had out, and it really talks about how are we using this environment to support each provider. And there are 5 steps that we look at. We're using the telephonic environment. We're driving value through data processing and data capture, through vitals, through discussion, through the text messages, through the bot, through the information that's being put in the system for the providers. And it's multiple touch points, helping to set up these telehealth visits, helping to set up office visits when they're available, reducing stress and anxiety that the older adults are feeling in their environment so we can keep them safe at home. We're doing that by layering these codes, as I mentioned, the 20, the 40, the 60-minute codes across CCM and RPM and BHI. In doing that, we're clinically appropriate and where it benefits the provider and benefits the patient to support outcomes and to keep people safe and home. So I wanted to just kind of close out on the fact that I understand many of the practices, many of the individuals on this call are challenged with the COVID-19 crisis. We believe that the remote care management services that we're offering under these programs are an excellent way to enhance the ability to connect out to the patient population, to address some of the concerns around the labor within each practice and the staff augmentation, and to drive additional practice revenue at a time when many of you are experiencing a reduction in visits. So I appreciate everybody having the opportunity to listen in today and for the opportunity to speak to you, sorry. And I'll open it up, Adam, for questions, and we'll go from there.
Yeah, this is Mike. Thanks, Dave and Adam. I just want to say quickly, some people did have a little bit of issue with the audio earlier. So just to let everybody know, we will be sending the recording out of this. So if you missed any of it at the beginning or had issues at any point, we'll be sending out the recording after. And obviously, you're welcome to visit amazingtrust.com/practice support that you see on the screen and schedule a personalized consultation also. So I did get one question in, Dave. It was kind of around the idea of billing and kind of what do they need to do at their practice in terms of handling the billing, if anything, for this program.
So today, yeah, it's a great question. So today, the practice is doing the billing. We bill when the practice bills. So if we meet 20 minutes, 40 minutes, or 60 minutes across multiple programs, we provide that information and data back to the practice. The practice would then bill, and then from that point, we would then bill the practice for a percentage of what they are billing. We do not, if we do not meet 20 minutes and we're just speaking to a patient for 10 minutes or 15 minutes, we're not billing the practice, since the practice can't bill it as well. So we're collaboratively working with the practice to make sure that it makes sense. In some cases, I will say as well, some of the practices have phenomenal staff members. Their visits are way down, and they have been they've actually looked to us to absorb some of those members short term to help support an environment where they can manage the labor costs that they have. And their individuals within their practice could support the patient population because they know them, they're used to dealing with these individuals. So a lot of flexibility that we have depending on the needs of the practice. But specific to the billing, we bill once the practice bills, and it's a percentage of that.
Right. We did have just another question on, I guess they just want to understand if they would be able to participate in this. I guess they'd have to talk to you to understand more on if they qualify, if their practice qualifies.
Yeah. So if you're currently on any of the amazing charts or family of amazing chart systems, we could have a conversation with you. We have a team, ready to speak. If you have a Medicare population, specifically those with 2 or more chronic conditions, and there are some of the other payers as well involved, I would encourage you to talk to one of the sales team's members at Amazing Charts, and then we can collaborate with them and have set up a separate dialogue. But if there is an interest from anybody on the call, I would really encourage a continued dialogue, and it's something that we can address extremely quickly for you.
We did have one last question come in. It just was kind of regarding how, we did just get one more question. Is this going to be HIPAA compliant after the COVID-19 pandemic is over? I guess just questions around security and how it relates to COVID-19.
Yeah, so these programs were in place prior to, and we have a lot of information that's come out from CMS that we can share with anybody on this call. It's all public information. These programs, and our solution is HIPAA compliant. We do have, remote access in a secure environment. These programs did exist prior to COVID-19. They've been really enhanced during COVID-19, and in post COVID-19, these programs will still exist and will still be utilized in a much bigger way than they were prior to. So I don't see, I see continuation of all 3 of these programs. They're driving. One of the things we didn't touch on much is that the results from practices and patients that are on chronic care management have been published by CMS, and they have been very, very good. And so if you look at a program that started in 2015, in 2020, January, just, slightly over 3.5 months ago here, they added G2058. Those 20-minute increments are significant benefits to this program, and it hit at a time when it could absolutely be used. So I do see this program continuing to be enhanced, and I think it's going to be tremendously valuable. I know for the hundreds of practices that we're working with across the country, they're finding a tremendous amount of value in it. Michael, you have another question?
And we did have a question on just how kind of telehealth fits into this, because obviously that was a big push recently, and just kind of how does this fit with maybe if they just got a telehealth solution recently?
Well, it's a perfect bolt-on to telehealth, right? Or frankly, this is more of a foundational program, and then you would bolt on telehealth. Telehealth, basically your remote exam room. And so, the way we look at it is you're utilizing telehealth to have that dialogue with that patient. I'm sure many of the individuals on this phone have heard, I've called up an older adult and they're struggling to connect to telehealth. And I know that audio is now available as well as a means to perform that remote engagement with the patient. But what we do with our leveraging CCM is we're setting up those calls. We're scheduling those for the provider. We're reaching out through the COVID screenings, through the individual dialogue with the patients. We're identifying other patients that would benefit from telehealth. And we're reaching out to those folks and then helping to schedule to make sure that they have the communication vehicles available to them, or a POA that might be able to help them, or if they're in an assisted living facility, a CNA or a nurse, somebody to help them. We're doing that prior to the provider getting on that telehealth visit. So I absolutely see them as two programs that work very, very well together. So if you have engaged in telehealth, I would, don't see it as anything that would slow you down from engaging in this as well. They're two very complementary programs.
Great. We don't have any other questions. So Dave and Adam, you can feel free to just wrap it up.
Sure. I promised my contact info in case anybody did have any suggestions for other solutions that we might look at offering to our practices. So you can reach me at that toll-free number on the screen, 866-382-5932. My direct extension is 63355. My email is alombardi, LOMBARDI, @harriscomputer.com. And as Mike mentioned, we will be sending out a recording of this. I know that some people did have some audio issues. I had a few people reach out to me as well. So thanks everybody for joining. David, thanks for the time, and thanks to all the people on the other end. Like David said at the beginning, hats off to all you guys. It's a crazy world right now, and we're proud to be behind all of you.
Great.
Thanks everybody. Have a great day. Have
Thank
a
you.
good weekend.
Thank you.